Hello and welcome to Active Therapy Clinic. Today we're talking about something that causes a lot of confusion and honestly a lot of unnecessary worry. Lumbar MRI scans and back pain. MRI is an incredibly powerful tool in modern medicine, but it is also one of the most commonly misunderstood tests when it comes to the spine. Clinicians see this all the time. People with terrible looking scans who feel fine and people with severe pain whose scans show very little. One of the most important things to understand is this. Degenerative changes on MRI are extremely common, even in people with no pain at all. Large studies looking at people without back pain have found surprisingly high rates of what many patients are told are abnormalities. For example, disc degeneration is present in many young adults and almost everyone later in life. Disc bulges and protrusions are very common. Facet joint changes increase with age. In other words, these findings are often features of normal aging, much like wrinkles on the skin or grey hair. They do not automatically mean something is wrong. Another key point from decades of research: the severity of MRI findings does not reliably predict pain or disability. Two people can have nearly identical scans and feel completely different. Why? Because MRIs show structure, bones, discs, joints. But pain is far more complex. Pain involves the nervous system's sensitivity, inflammation, stress in lifestyle factors, movement patterns, sleep, mood, and many other influences. An MRI cannot measure these things. MRI shows anatomy. It does not measure pain biology. Now, this doesn't mean MRIs are useless. Far from it. Lumbar MRI is extremely valuable when used correctly. It helps clinicians rule out serious conditions, understand spinal anatomy, plan procedures or surgery when needed. But the crucial principle is this: MRI findings must always be interpreted alongside a clinical assessment. A scan alone cannot diagnose the cause of back pain. If you've had an MRI and were told you have disc degeneration, a bulge, or other changes, please remember these findings are very common. They often do not explain pain by themselves. They do not guarantee ongoing problems. What matters most is how you feel, how you move, and how your symptoms behave. At Active Therapy Clinic, we look at the whole picture, not just the scan. We combine imaging, physical assessment, and your personal experience to guide the right treatment approach. If you have questions about your MRI or your back pain, we're here to help.